right. Thank you everyone so much for tuning in to watch our poster presentation about effective group interventions to empower both CHWs and communities. We are hailing from Rush University Medical Center, from the Department of Social Work and Community Health, and particularly the Rush Generations program, which is a free health and wellness program that serves older adults, people with chronic health conditions and disabilities, and caregivers, primarily throughout the west side of Chicago. And my name is Patrick Stanley, and I am a social worker and program manager in the Rush Generations team.
Hello, and I'm Yesenia Cervantes Vasquez. I am the community health worker on the team.
Lead community health worker. Yeah. So essentially today we're going to be talking a little bit about what are the evidence-based group programs that we offer, how do we integrate those into the community, and how do we train and support a CHW workforce to implement these programs. So to start off with evidence-based group programs that we offer, we first have to talk about what is an evidence-based group program. So essentially, it's very different from evidence-based practice, but kind of similar in the way in which we're thinking about the evidence-based group. So it's a group intervention, but it is usually replicable and typically manualized so that it can be standardized and implemented the same from place to place. And it's essentially proven by research in random control trials. And through that research of that replicable and manualized intervention, it shows that it's effective for populations by certain standards. So for example, you have to really look into an evidence-based group program and find what is the actual evidence show of the outcomes that you will get from this program. So essentially, recognizing that as long as the fidelity is adhered to and the program is implemented within quality and how it's designed to be implemented, then the participants will be able to get certain outcomes out of that program. So depending on the model, facilitators have to adhere to certain standards, guidelines, or qualifications to obtain and maintain their certification. The program is usually managed and overseen by some agency, organization, or business. And through that, to ensure that the quality is there and that participants who go through the model are able to get those same outcomes, there's usually a lot of training and fidelity monitoring that's standardized and incorporated. And you can understand how when we look at all the things that go into an evidence-based program, it takes a lot of infrastructure to be able to do this well. And so at the end of this presentation, we'll talk a little bit about how you can get connected with organizations around the state so that you can get into this, the infrastructure that's already being built. So the programs that we offer through the Rush Generations program are the programs that are recommended by the National Council on Aging, also referred to as NCOA. And the programs are usually divided into CDSME, which is chronic disease self-management education, and fall prevention. And all the programs that we offer in both English and in Spanish, and then also offer them virtually and throughout the community. So essentially the programs that we offer are Take Charge of Your Health, which is general chronic disease management, Take Charge of Your Diabetes, which is specific to diabetes and prediabetes, Learning to Live Well with Chronic Pain, Cancer Thriving and Surviving, WRAP for Seniors, which is emotional wellness, and Walk with Ease, which is a structured walking group. And then under fall prevention, we have A Matter of Balance, Tai Chi for arthritis and fall prevention, Fit and Strong, and Bingo Size.
Thank you, Patrick. And so we have seen that there are a lot of benefits for our evidence-based workshops for group participants, not just within the topics that we cover within each of the sessions. So like nutrition and exercise and, taking your medications correctly, et cetera. Not only in those areas is there an improvement, but also in the overall quality of life. People also see an increased self-efficacy in managing their own health, whether that's like before going to the doctor or after, right? Being able to ask the questions, advocate for yourself, There's an increase in maintained independence, positive health behaviors, and or mobility. People are feeling more um, wanting to be out there to engage in more activity. So that's always really good for positive health behaviors. They have been very effective in reducing falls and reducing or controlling pain, improved mental health, including easing social isolation and depressive symptoms. So it's no surprise to any of us that, during the COVID-19 pandemic, while we had a lot of stay-at-home orders, we saw a lot of isolation and depression rising, and specifically within older adult populations, but just everyone in general. I think we were all feeling very disconnected from one another. We were not gathering. So the social structure, being able to connect to other people, it's very important for our health, physical and mental. And so we have seen that now that we're being able to get back, even in the virtual groups, we see an increase in. So if you look at the right hand side, what the bars are, the green bars are the rush numbers for our participants, and the gray is for the national average. So if we look at loneliness and isolation, even though it reads a little bit opposite, the score is lower nationally, meaning that people are feeling overall more lonely and isolated than for those who take our evidence-based groups. And so there's an increase in being more connected and feeling more supported and having a better sense of community. And same with self-rated health. So things like, being able to take care of one's own health, feeling healthy, feeling good about one's health. The national average is also slightly lower than, our participants completing both our our pre-surveys before we start the workshop. And then after our workshops, we conduct the post-surveys, and that's where we see an increase in the things that were not so positive at the beginning. And so becoming a little bit better toward the end, which is wonderful to see. And then overall in our health confidence, you can see that our rush numbers after our participants complete our workshops are significantly higher, almost twice as high as the national average. And that is key to people being able to take ownership of their own health, right? And being able to feel empowered into making those changes that they've been needing to make for some time.
Yeah. I think a big reason why we get to see those numbers is because we have CHWs and people from the community leading these workshops and really engaging folks and providing that wraparound care.
I would agree 100%. And so that takes us to this slide, which is our, the benefits for CHW. So for us, in leading our evidence-based workshops, so I myself am a CHW, and I started actually as being a participant in one of the groups, loved it, saw the impact, then became a facilitator. And one of the things that I love the most about facilitating this workshop, which led me to switch over to actually be on the team with Patrick, is that we rarely get to walk with the patient, or with our participants throughout anything really. So as CHW, we're wonderful at connecting people, right? We see the need, we connect them with resources, we sometimes escalate to our fellow social workers, or, we connect them to a doctor or another organization. But often it's not us who's able to provide the services because, it's out of our scope. And being able to be trained in these programs means that for all those 6 or 7 weeks that people participate in those workshops, I can be leading them through the workshops. It can be me who provides all that intervention, and I get to see the results. I get to see people becoming motivated, people doing things that they said, no, I can't do that, or that's, I that's not something I could achieve. And then they do it, and then they love it, and then they keep it up. And it's so rewarding to be able to see that, to be part of that change that hopefully down the line will lead to, lower chronic conditions or more manageable chronic conditions. So other skills that are key to all of us as CHWs, as promotoras, is we learn group facilitating skills, which are wonderful. We can use them in delivering presentations and doing other types of work. We learn more about various conditions, right? Sometimes when you're in the middle of a workshop, a participant will ask you a question about heart disease or something else that I am very comfortable saying, I don't know the answer to right now, but I'll bring you some information next week. And so then I have my homework. I learn more, and then I am readier for the next time, and I'm able to bring that participants some more information. We also feel the sense of empowerment because we get to directly help our communities. You know, we get to be, again, the workshops can happen virtually, or we can go within our own communities, the churches, schools, wherever we know there's a need, we can have those groups there. We also learn skills to reinforce indirect practice. So again, being able to be the ones actually delivering those services. And CHWs are accustomed to identifying social determinants of health needs among group participants, which is, I think, what Patrick was also getting to, that because we're so connected with the communities that we're serving, oftentimes we are part of that community with those same lived experiences, and part of those groups, or our parents were just like our participants, right? And so we know how to approach certain subjects and or see things that someone might not be explicitly saying, but we're able to pick up on that need and then, you know, talk to someone about hopefully offering them more resources. So it's very good to be able to have that that connection, so we can offer our participants even more support about around other needs that they might be having aside from their health management. Patrick, you're on mute, but right back there.
Thanks so much, Jasenia. So now, you know, we've learned that about the programs that are out there and available, and then that they're beneficial to both the people who are in the community as well as the CHWs who are leading them. So how do we talk about how we integrate into the community? So essentially, um, how we approach our work is that we train people who are from the community and reflect the communities that we serve. And that shouldn't be as controversial or as groundbreaking as it is. But up until recently, this is starting to change, and really started to change in 2018 and 2019. But in 2017 is when we really started at Rush to really realize that a lot of these evidence-based programs were being offered by social service agencies and area agencies on aging, healthcare systems, et cetera. And they were training their own workforce and then sending their workforce out into the communities to offer these programs. But in 2017, we started to realize, why aren't we training people who are from the community and giving them that empowerment to be able to offer this intervention to the people that they live with and relate to every day? And so essentially, what we started to do is we started to train people from community-based organizations, CHWs and promotoras, community leaders, faith leaders, et cetera. So we started to train them to implement these workshops. And then through us being a larger institution that has more capacity and funds to be able to support these initiatives, we were then able to, you know, really ensure the quality, make sure people feel supported, and supply all of the supplies and technical assistance necessary to make these workshops successful throughout the community. And through that, we've increased a lot of engagement, we've improved the outcomes, and we're seeing higher numbers of people sticking with the groups and participating in the groups. So we'll talk a little bit more about the different places in which we offer this, but just through our CHWs implementing these workshops, instead of the old the old problems that we used to have of not having enough participants in our workshops, we have a different new problem, which is often having way too many people in the workshops to the point where we have to schedule more workshops. And it's been really because we're getting into like the enthusiasm and gaining the trust of the communities, and then offering this really meaningful intervention.
Yeah, so we've been very fortunate to be invited to different places to be able to do this, and also like making our way to a lot of those places, like you were saying, Patrick, like gaining, you know, the trust of those communities. So we really go anywhere. Like we always tell people, wherever you have a group of at least 10 people who are really committed to wanting to have this workshop, we'll go to you. So if that's a church or a faith-based organization, we're there. I'm currently right now doing a workshop in a church in McKinley Park. And so it's, again, you know, we'll go there. Obviously, we've been offering them at our senior centers and our senior independent living facilities, which is where a lot of these were being offered already before. Community-based organizations and social service organizations. Again, we have so many organizations that work in different communities, and it's really nice to be able to partner with them to either for them to host a workshop that we deliver there, or even be willing to have some other staff be trained so that they can become facilitators, because there's nothing better than the organization that's already trusted by the community, known by the community, where they know they can go there for other services. People are already going there. We might as well integrate these workshops there and have their own people be able to deliver them, always with our support, of course, and whatever's needed. Another really wonderful place where we've been doing a lot of work, which has been happening for a few years now, is in the Head Start programs, such as El Valor here in Chicago, in our school parent universities through some CPS parent university groups. And the really neat thing that I love about working with schools and with programs where there's potentially younger children that are connected to the participants, whether that be their parents or grandparents that are in our workshops, is that it's exactly that when the caretaker learns how to take better care of themselves, right? Start practicing better health habits, starts becoming physically active and just engaged in their well-being, then that positively impacts the child. And hopefully we also see, like, that these chronic conditions that sometimes just happen from generation to generation, like that, we hopefully see that's inevitable, or that's not inevitable. We can definitely prevent a lot of things through better education of our parents, our grandparents, and that's a wonderful thing to be able to see. That people sharing, like, oh, I started now reading the nutritional labels I've never read before, and now I'm not giving my child those potato chips, I'm giving him an apple. Or like my daughter, who was always on her phone, she's now joining me for my walks 3 times a week. I love hearing that. I love it. It's wonderful. And then we also have other community centers that we have identified through collaboration. Patrick will tell you best, but like, gotten really creative about places where we go, and we really will go anywhere to be able to host these workshops.
Yeah. Bookstores, the conservatory, the park district. Yeah, we'll go anywhere really. So essentially you may be wondering, okay, how do we get involved? How do we train people? How do I get my CHWs trained? And so essentially, you may be wondering, how can we make this happen? And so one big thing that we do is we really try to align the evidence-based programs, because they can be quite the lift. It takes a lot of training and it takes a lot of time to be able to lead these groups. We really try to make sure that facilitating these groups aligns with existing initiatives in the organization and responsibilities of the organizations and the CHWs, so that it makes sense for them to be leading these groups. And then we also really reinforce the professional development and skills development and that leadership that comes from being able to lead these workshops. So we really meet with the leadership of these organizations to say, don't you want to contribute to the professional development and skills and empowering your CHW workforce and retaining them, and really motivating them and bringing up that enthusiasm. And so we really kind of integrate it into their existing initiatives and responsibilities, so that they're able to not just empower their communities, but also empower their workforce. And then essentially we also adapt our training to accommodate schedules. So oftentimes CHWs and promotoras may not be able to dedicate to full day trainings. And so we will split up the trainings to half-day trainings or virtual trainings, etc. So if you're interested in becoming a facilitator, the base model of chronic disease self-management education is Take Charge of Your Health. And it is an in-person training that's 24 hours given by 2 master trainers, usually over the course of 4 full days or 8 half days. And then the virtual training is 13 2.5-hour sessions over the course of 6 weeks. And then once you have that base model, you're able to take the additional crossover trainings to be able to facilitate the groups specifically for cancer, diabetes, chronic pain, or HIV management. And then another work training that we offer is a matter of balance. This is an 8-hour training that is given for either 2 half days or 1 full day. And that is the training that is to help people overcome their fears and concerns about falls and improve their balance and get to higher physical and social activity levels. So if you are in the city of Chicago and you want to be involved in these programs, reach out to me. If you are in anywhere in suburban Cook County or anywhere else in Illinois, reach out to Joan Fox at Age Options. They head up the Illinois Pathways to Health Collaborative. And if you're outside of the state of Illinois, reach out to the Self-Management Resource Center to inquire about trainings in your area. And if you are interested in having a workshop at your organization, please reach out to us as well. There's absolutely no cost to your organization or participants. We provide all of the supplies. We assist you with recruitment to ensure that your group is successful. And we can also escalate issues that are identified in group to our rush social workers and community health workers. And here's our contact information if you'd like to reach out.
And we both speak Spanish, so promotoras feel welcome to call us.
All right. Thank you all so much for your time.